Okay, welcome back to Braxton News. I'm here with our medical director moment. So this is Dr. Tony Gandia. Again, my name is Bill McGrath. Doc, we have a question. These medics around the world are being faced every day with calls for narcotic overdoses. Primarily, we're seeing a lot of fentanyl. So how much is too much? We have crews giving 2 milligrams, 4 milligrams, 6, 8, 10 milligrams of Narcan to wake some of these people up. Should we worry about such high doses of Narcan?
Yeah, it's interesting because never in our past did we ever have to treat so much Narcan, and primarily the reason is because there's so much opiates within these individual systems. So the question is, how much is too much? We really don't know. I think we have to kind of gaze on how the patient is doing. If they start to wake up, remember, one of the most important things I think we need to realize is that what we're trying to do is reverse the respiratory problems that we're having, because that's the one that's really going to be a significant issue. The fact that they're in a respiratory failure, so to speak, because they're not having any respiratory drive. So as soon as you see that respiratory drive really getting better, that's when you start to be careful on how much more you're going to give. One of the things that comes up at times, which we had never really seen so often before, is that flash pulmonary edema. And people say, well, why are we seeing flash pulmonary edema with Narcan? Well, because we never gave that much. We never gave such huge dosages of Narcan to get to the point where it could become a problem.
So we wake the patient up, or at least we increase their respiratory rate, and in some cases, once the rest of the Narcan kicks in, they wake up. So medics, again, are faced with the dilemma of now they're awake, and we leave them at home. They're awake, alert, oriented, so they sign refusals. What's the potential risk of somebody that's had an opiate overdose that's left at home? And there's a lot of programs that we can leave behind Narcan and things for the family members, but what are the potential risks to the patient by staying at home and not being transported to the emergency center?
Yeah, that's a great question, Bill, because one of the things that we say, well, what are we going to do? The patient is awake, now they don't want to go to the hospital, and I think we have to realize very clearly that depending on how much Narcan we've given them, we know that there's a significant amount of opiates within their system, so they really have a sort of a large load of opiates within their system. The problem is we wake them up, the Narcan is on board. Now, let's say half hour or an hour later, that Narcan now is out of their system where the opiates are still working there. So ultimately, the shorter half-life of the Narcan will go away, the opiates are still within their system, and now they can go right back to where they were, an hour ago. And now, again, they can go into the problem, they can have an issue, or really have a respiratory arrest. So I think one of the most important things, and it's all about education, is explaining to these folks, because now it is a good question, because they're awake, they're alert, they don't want to go. I think we need to educate them and say, hey, listen, we gave you the Narcan that could be temporary, but you can fall out again within a little time because you still have all those opiates within your system. And I think having that conversation with them and making them realize that they still can get into trouble, later on is probably paramount to us really taking them back to the ER where they get better evaluated.
Great.
Thanks.
Thanks, Doc. There's another medical director moment here for Braxton College.
Thank you, folks.